sacral fractures. Anatomy: the femur, the ilium, the hip joint, and the sacrum. Fractures of the pelvis include sacral fractures, which vary in severity from mild to severe. Types of fracture of the sacrum modified from Dennis classification. Zone 1, injury lateral to the sacral foramina. Zone 2, injury involving the sacral foramina and the spinal canal is not involved. Zone 3, injury extending into the spinal canal. Zone 1, sacral alar fracture. The fracture involved the sacral ala. Neurological deficit is less than 5%. It involves the L5 nerve root, which runs on top of the sacral ala. The patient may get a foot drop. Zone 2, foraminal zone. Neurological deficit in about 30%. It involves S1 and S2 nerve roots. Most difficult zone to fix is associated with some loss of fixation. Zone 3, fracture involving the central sacral canal. Neurological deficit in about 60 to 100%. Usually it is a coda equina with loss of bladder, bowel, and sexual function. Zone 3 can be longitudinal or transverse. Longitudinal fracture. It is a midline fracture involving the sacral canal. The CT scan axial cuts will clearly show the injury. The canal is compromised and usually it requires reduction and surgical decompression. Transverse fracture. It is a U-shaped fracture. The weakest zone is located between S2 and S3. The axial load will cause a transverse sacral fracture at its weakest part. It can lead to canal compromise, and it is better detected on a lateral view of the sacrum. The CT axial cuts will show double foramen. You'll find double shadow on an AP view. The proximal part of the sacrum is connected to the spine. The distal part is connected to the pelvis through a very narrow strip of sacrum, ala, and SI joint. And these are the three types of sacral fractures: type 1, type 2, and type 3, the longitudinal and the transverse. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.